heart is the most popular organ in the body. From pumping blood around the body to pumping blood to nourish itself, the heart is one special organ that needs all the care and nourishment. High blood pressure is a symptomless disease of the heart that quietly damages blood vessels and leads to serious health problems. While there is no cure, medication and lifestyle changes have been proven to enhance quality of life. This is The Physicians. So join us as we discuss more on this interesting topic with our experienced and brilliant guests. You can't but have the best from The Physicians. Show The Physicians, we will be discussing a very important topic, the heart, and coping with high blood pressure. We do understand the fact that the heart is very important to your holistic well-being, because if your heart is not pumping, it means literally you may not be alive. But the truth is not just about the function of the heart, but dealing with high blood pressure. Is there a particular age group that are more at risk of high blood pressure, or a particular gender? Today on your show, I wouldn't be speaking more because we have an expert who knows a whole lot about high blood pressure. And who are these people? The cardiologists. But before we go to see our guest, my name remains Dr. Memuna Yusuf Kadri.
Dr. Martina Agberian. I welcome you to The Physicians, where your health is our
business.
Dr. Martina, we're talking about coping with high blood pressure.
How common is that?
Is it your portion in the first place?
No. See, I would not say it's not my portion, but facing reality, my both parents are hypertensive. So it then means
you're a risk factor?
I'm at risk of having high blood pressure. And this literally means I have to take precautionary measures. I have to tell myself when I'm going through a lot of stress or thinking or generally going through some challenges in life. I like, look, both parents, both grandparents, like it's really, I'm not saying ingrained, but a lot of my family members are hypertensive, so I don't joke with it when I know I'm going through a whole lot. But of course, science will tell you that even if you are taking care of every other thing, it's just the reality to know that you are at risk, but ensuring lifestyle modification. So I've modified my life to an extent that, look, I let some things go. I pick my battles. I know what to eat. Being a physician, that has also really helped, but I'm taking life one day at a time.
Taking life one day at a time is very, very important, Dr. Memuna. And familiar history, your parents, both of them are hypertensive, and so you are actually at risk. Fortunately for me, none of my parents were hypertensive, but they're gone now. God rest their soul. And but that does not mean that we won't check regularly, because there are other risk factors.
Exactly.
Okay? The fact that your parents were not hypertensive, that does not mean that you can't become hypertensive.
Welcome back. If you are just joining us, this is The Physicians, where your health is our business. And today on the show, we are going to be discussing coping with high blood pressure. With us on the show today is no other person but a renowned professional, cardiologist of over 30 years experience. Is no other person than Dr. Eugene Nwosu, the MD of United Heart Hospital. You are welcome on the show, sir.
Thank you very much for having me.
Dr. Nwosu, you're welcome to our program, The Physicians. And you've practiced medicine for like 33 years, and you graduated from the University of Ibadan and left for the United States of America. We've been talking on this program about our doctors, brain drain, and death of doctors, one doctor to over 10,000 patients, and you have practiced medicine outside Nigeria. Before we go to the real topic, just tell us why you came back.
Well, first of all, I'm a graduate of University of Ibadan Medical School, and I left for America in 1984 for my residency and fellowship. And I did that for about 8 years, after which I went into cardiology practice. And I've been a fellow of American College of Cardiology, a fellow of American College of Physicians, and a fellow of American Heart Association.
Wow.
And before this time, I noticed that there was great need in Nigeria, and we launched a foundation that in 2001 that did medical missions to Nigeria. So I've been in touch here on a yearly medical mission, so I know what the needs are. Then it came to a point that having accomplished, my dream in America. My children, are well educated, top schools in America, they are doing well. And there is so much need here in Nigeria. Basically, it's time to go home. Time to go home to help the needs of the society. We have brain drain, we have lack of specializations, and people are seeking health care all over the world. India, UK, name it. Nigerians are just flocking out because we lack services here. So the best thing to do is go home and give back.
Welcome
back.
Go
home and give back and make a difference.
It's good to have you back home.
Thank you.
Good to have you back home.
Yes.
We're talking about the heart. Yes. And high blood pressure, coping with it.
Yes.
I'm sure you've had experiences, you have a lot of patients. So let's start with the basic. Tell us about the heart. How it functions, the normal function of the heart. So we can know what happens when we don't take care of your heart and subsequent consequences.
The heart is the engine of the cardiovascular circulation. So every organ in the heart needs oxygen and nutrients. And the heart is the engine, the pump that pushes the blood all over the body. So the heart is so important that if you have cardiac arrest, when you have fibrillation, ventricular fibrillation, and your heart is at a standstill, if you do not restore the circulation, that is effective blood pressure and heart rate, in 4 minutes, you have brain damage.
What is fibrillation so that they can understand?
Fibrillation is when you have a blood clot. The commonest cause about it is a blood clot blocking an important artery in the heart. And the heart can respond. That's actually heart attack about to happen. So when you have a blood clot that completely cuts off blood supply here, there are 2 things that can happen. The heart will not like it. The heart will just fibrillate and become stand still. That is cardiac arrest. The second thing that can happen, you may not have a cardiac arrest, but you have severe chest pain. And if you don't relieve the obstruction, you're having a massive heart attack. So if you have a cardiac standstill, which is fibrillation, if you do not correct that in 4 minutes, you have brain injury. If in 10 minutes you do not restore the circulation, you are dead.
Brain dead, or you
are brain dead, and then you won't survive it. So that tells you the importance of the heart. So if you have problem with your heart or circulation, you are at risk of serious health issues, morbidity or mortality. You are actually gone. what happens is that the heart collects oxygen-rich blood from the lungs. It flows into one of the chambers of the heart. You have 4 chambers, by the way. You have the 2 upper small chambers called the atrium, and you have the ventricle, the 2 bigger, lower ones. So oxygen-rich blood comes into the left ventricle, and with the contraction, it's pumped into the aorta, which is the big circulation. And this is distributed to the body, over the body. It delivers oxygen and nutrients. And the used blood, which does not have oxygen, now returns back to the heart, back to the lungs, picks up more oxygen, and goes back. So that is why it's all circulation.
Exactly. So it takes the blood, which is oxygenated, goes to circulate, finishes the oxygen, and comes back to get more oxygen and
circulation. So the heart is very important. Now, if you're talking about blood pressure, because blood pressure, high blood pressure is a very common disease of the circulation. And it is commonest in we Africans.
Oh, wow. Than the Caucasians?
Yes, than the Caucasian. Every race has it, but somehow it is more common in Africa. Something with our genes.
So
you know, we are in the tropics and all that stuff. With all that, somehow our kidneys hold on to salt.
More.
Let me give you an example. If you get a Caucasian and give them an infusion of salt water called saline, and you collect the urine that they produce, it will dump almost all the salt. If you get a typical African and give them that salty water, saline, and collect the urine, there is no salt. The body retains that. So we are salt sensitive. Something in our gene predisposes us to high blood pressure. And the bad thing about high blood pressure is so common. In fact, the prevalence, number of people that have it, in some populations in Nigeria is up to 40%.
That bad?
40 out of 100.
It's just a population. Wow, just a community.
The community. So, it's not less than 20%.
In any community?
Yeah, but in some, it's as high as 40%. And the bad thing about it is that it is symptomless in most people.
Yeah, in fact, that is my silent killer.
That's the point. Silent killer. You are just walking around. In fact, when we are having medical missions, we come in here, we see people with first time knowing that their blood pressure is 250 over 130.
The cops. So that's the cops walking.
Those are the type of people that all of a sudden, boom, they just have a massive stroke and collapse and then die. Or some of them will present for the first time. They do a simple blood test. They say, you have kidney problems. Because uncontrolled hypertension damages your kidney, causes stroke, causes heart attack, and in Nigeria, causes enlarged heart and heart failure. That is the #1 complication of untreated high blood pressure. Big heart and you're in heart failure. So high blood pressure is a very important disease. And by controlling high blood pressure, we can decrease the incidence of these complications and the mortality.
So what are the symptoms? How do people know present if they have high blood pressure?
Because if you're walking on the street,
a few people, remember, it is a silent disease because most people do not have symptoms.
You are right.
You may have a blood pressure of 200 over 110, you have no symptoms. There are some people that are lucky to have symptoms. So when you have symptoms, you are lucky because that takes you to the doctor. So what are the commonest symptoms of high blood pressure? Some people may have headache. If you are having headache, please stop going to buy Panadol and be taking. Check your blood pressure. Headache can do that. Sometimes palpitation. They feel that their heart is pounding and then sometimes it's skipping and fluttering. Palpitation is also a known symptom. Now, some people may have severe high blood pressure and they start having chest pain. Because in that case, they might be having clogged arteries, coronary artery disease, because their arteries are clogging up. So when they try to move, when they try to walk fast, they want to climb upstairs, they start having like heaviness in their chest, like an elephant or a weight on their chest. If you're having that, you may have angina, coronary artery disease, which can result from high blood pressure and other things. Okay. Sometimes when it's too late, you may notice that you have leg swelling. Because you either, when you're having leg swelling, it's either your kidneys are involved or you're having heart failure already. The other one is you get tired easily. You walk a short distance, you're panting for breath. So that might be a sign of heart failure. Okay?
Even so, without exercising?
Without, you know, just minimal activity. So those are some of the signs if we are lucky. But remember, most people do not know they have it. So the easiest way to make a diagnosis is to have your blood pressure checked.
But how regularly do people, are we supposed to check our blood pressure? Because people, we don't even have that culture of preventive medicine, buying the speak to keep and check from time to time. Because that is very key for people to know how regularly.
Let me say this. Even from teenage years, okay, by the time you are 15, 16, you must know your blood pressure. And if your blood pressure is normal, please check it at least once a year. And we're going to talk about what is normal blood pressure.
Exactly.
If your blood pressure is normal, you check it at least once a year. If your blood pressure is high, please go to a physician who can take over your management. And you'll be given instructions on how to treat high blood pressure, because we're going to talk about it.
Yes.
That's very important. Treating high blood pressure is not just taking medication.
Yeah, right.
You start with lifestyle changes and then add medications. So the doctor will now schedule you for regular checkup to control your blood pressure.
This is becoming very, very interesting, sir. We've heard you telling us that if you have normal blood pressure, not high now, at least check once a year, just to know what it is. But if it is already abnormal, check in with the physician who is going to give you the right treatment, what to do, how to do it, who is even the right doctor that you should meet. We'll be right back after this short break.
My name is Cordelia Obe, and there's something I've come to know. A lot of us have questions in our hearts concerning our health or the health of the people around us. Sometimes you do not want to ask people questions. But guess what? If you watch the program The Physicians with Dr. Martina and Dr. Memuna, guess what? Oh, they are double M's. Ooh, you may just get to know a lot about what's going on in your own health or your own life. So watch it, whatever is on the air. Peace.
We'll be talking about the heart, coping with high blood pressure, with our own consultant, Dr. Eugene Nwosu. He's told us a whole lot, very revealing, and we just don't have enough time. But we'll see how we can cope with it. Dr. Eugene, you told us about some of the risk factors, and we need to first of all define blood pressure. What is high blood pressure? At what point do you say this person is hypertensive?
Okay, when the heart, you know, heart is a pump. When the heart pumps, that pumping will dump the blood in this artery, the aorta. That initial pump, the pressure that is generated is your top blood pressure. That is what causes systolic. And then when the heart relaxes, the vessels relax. The pressure you measure at that bottom of relaxation is your diastolic blood pressure. So blood pressure has two readings, the top, which is the systolic, and the bottom, which is the diastolic. Now, in the past, we used to say that if your top blood pressure systolic is 140 and above, you have high blood pressure. If the bottom one is 90 and above, you have high blood pressure.
No, that has changed?
It has changed.
Wow, evidence-based.
Because they have found out that people that carry that blood pressure that are not treated, they develop complications over time.
Really?
So, the new definition of high blood pressure is this. First of all, what is normal blood pressure? If the top one is 119 and below.
119.
119
and below.
So that's lower than 119.
Yes, 119 and below. That is normal blood pressure. The bottom one should not be higher than 80. Okay. Now, if the top one is 120 to 129, okay, and the bottom one is 80 to 89. No, 80 to 85. Okay. So you have elevated blood pressure. You are not considered high blood pressure yet. You are called elevated blood pressure. But once the top one consistently hits 130 and above, bingo, you got high blood pressure.
Wow.
Okay. So,
and the lower one?
The lower one should not be more than 85. Okay.
What?
So
there are lots of people with high blood pressure.
Absolutely. Okay. So that's what it is.
Wow.
So hypertension, that tells you that you have to take it serious. Okay. However, when your blood pressure is about 130, okay, between 130 and 139, okay, you don't need medication. Lifestyle can control it. Okay. As long as you don't have other complications. Because if you already have kidney problem or you have heart problem, then that is too high. You need to be on medication. But if you don't have any complication, between 130 to 139, you can use lifestyle to control it. Okay. So that is what high blood pressure is. So that tells you that a lot of people are walking around and they are what? Time bomb, walking time bombs, waiting for a catastrophe to happen. Now, you're talking about risk factors.
Yes, please.
The first thing about risk factor is know your parents.
Yes, so
their history, the family history.
like me.
If your parents, both of your parents have high blood pressure, the likelihood of you getting it is very high. But you don't have to claim it because you can modify your risk.
That's it.
You can modify your risk. So family history is important. The second thing that can lead to high blood pressure is poor diet. If you are eating salted food, you know, salted crackers, salted peanuts, salted, and you put too many salt in your food cooking, you're likely to have high blood pressure.
All these condiments,
yes,
Maggi and all those stuff, you know, all those things have, you know, high blood pressure and some other preservatives that cause some other health problems. Okay, so that is another factor. If you are not physically active, you are just a couch potato, sedentary lifestyle. You can't even put on a television. You have to use the remote control, you know. Or you have a grandchild. You say, go and turn in this, you know. So all those couch potatoes. Or you drive to the mall. You want to park next to the gate. Okay, you are not getting enough exercise. That is a risk factor. Obesity, okay, is important. Especially if your body mass index is 35 and above. You have morbid obesity, okay. That is a problem. Okay, if you are a young female and you are taking birth control pills, risk of high blood pressure and even stroke.
Contraceptive.
Birth control pills, they have estrogen. Okay, those things put you at a risk.
So don't think because you are young and you can't be hypertensive. It's a risk factor, especially when you're on those
Absolutely. And then if you eat, you know, some of these people that they don't drink water, they have to drink everything. They have to drink soda, Coke, 7-Up, you know, just taking all those sugary, you know, and even juice. When people don't drink water, now they use a whole bottle of juice as fluid. So what you're taking too much sugar.
Yes.
And you're taking too much fructose. And too much fructose will actually increase your blood pressure. Alcohol. I mean, in Nigeria, people drink so much and you see men that have big belly that as if they are 6 months pregnant or 9 months pregnant. That is a catastrophe. That is a heart attack in the waiting.
But there are a lot of men that are pregnant on the funny.
This is not funny.
Obesity. Listen, I've lived in America, and you go and you see that obesity has come to Nigeria. I'm telling you, and it doesn't have to be with wealthy people. Okay?
Yeah, right.
There was a time my driver here, you know, has a belly, and he's a young guy that is maybe, you know, 34 years old. He already has a belly. Okay, so it's not a question, and it's also poor diet. People are eating too much carbohydrates.
Let me just be satisfied, not exactly.
And they don't exercise.
Yeah.
You know, KK is everywhere. Okada, people, short distance. Nobody is doing what we used to do those days. Okay, weight is an issue, quite all right. You should not be overweight. But if you are overweight and you exercise regularly, the exercise protects you.
That you must take away is it is better to be fit. Right?
Yes. Better to be fat and fit than to be slim and unfit. I remember some time ago, a bus conductor was fighting with one of the persons that entered his bus, and the bus conductor didn't know that this man might be dealing with any illness. The next thing, he just shoved him to the side, and the man collapsed and he died.